Over the last decade, the public has witnessed a growing interest in the benefits of vitamin D. The problem is, many experts are debating testing procedures and serum levels considered adequate. This has led to inconsistent recommendations. To address these concerns, the American and Canadian governments asked the Institute of Medicine to review the evidence and revise recommendations for vitamin D, which have not changed since 1997.
In November 2010, the IOM released new guidelines for vitamin D. Previously, recommendations were 200 IU for those up to age 50, 400 IU for those 50 to 70 years old, and 600 IU for people over the age of 70. After examining over 1,000 articles, the committee came to the conclusion that North Americans need on average 400 IU of vitamin D per day. People aged 71 and older may require as much as 800 IU per day because of the changes associated with aging. Serum 25-hydroxy-vitamin D is the amount of vitamin D circulating in the body. Recommendations are based on maintaining a level of 50 nanomoles per liter, the level most adults need for healthy bones. Newer research has suggested vitamin D may help prevent multiple chronic diseases such as cancer, diabetes, and cardiovascular disease. The most convincing studies relate to vitamin D and cancer. These studies show an association between low blood levels of vitamin D and higher risk of cancers like colorectal and breast cancer. Research also suggests sunlight strength and exposure play a role in the relationship between vitamin D and cancer. Lower rates of colorectal and breast cancer are observed in populations closer to the equator where the sun shines the longest and strongest. Dr. Edward Giovannucci, a professor at Harvard School of Public Health, states, "I would challenge anyone to find an area or nutrient or any factor that has such consistent anti-cancer benefits as vitamin D."
Part of the reason why vitamin D levels in humans are difficult to assess is because people synthesize the vitamin from sun exposure. The amount of vitamin D our skin makes depends on our genes and skin color, as well as how much sun we get. The IOM's guidelines assume minimal sun exposure. Given the relationship between sun exposure and skin cancer, they wanted to be responsible with the recommendations. The American Cancer Society and the American Academy of Dermatology both recommend a minimum SPF of 15 to prevent skin cancer. SPF 15 blocks 93% of the sun's rays, reducing the amount of vitamin D your skin makes. Despite the fact that few foods naturally contain vitamin D, the IOM suggests that most people should be able to meet their needs through diet alone. Vitamin D intake can also be increased with a multivitamin or supplement. Multiple studies involving vitamin D have had conflicting results. There is also a lack of randomized controlled trials, the gold standard of science. Existing evidence on vitamin D's benefits point to areas that could use more research. Christine Stenzel from the IOM states, "What happens in mice or cells yields signposts and clues, not certainty about what goes on in people's bodies day to day. After all, we've cured cancer in mice many times, and while that's helped lead to effective therapies in people, we certainly don't yet have a cancer cure." While the IOM has made recommendations based on as much concrete evidence possible, some experts will agree to disagree. Dr. Michael Hollick still recommends 1,000 IU per day for children and 2,000 to 3,000 IU per day for adults. Vitamin D will likely remain a nutrient of interest in the future, and evidence will pile up across the spectrum ranging from positive to negative. Eventually, there may be more substantial and conclusive evidence pointing one way or the other. Until then, vitamin D recommendations remain a controversial topic amongst experts.